Well, good afternoon, everyone, and welcome to Trust for America's Health's Age-Friendly Public Health Systems February training. We're happy you're here to join us today to learn together with us to learn more about how the public health sector can support older adult health and well-being. My name is Megan Wolf, and I'm joined today by our policy development intern, Katie Vinson. Katie, thank you for helping us with the slides today. The AFPHS movement would not be possible without the generous support from and partnership with the John A. Hartford Foundation. We're really very grateful for our partnership with the foundation. Next slide, please. So we ask that you all please keep your devices muted during the presentation so that we can avoid any background noise. But do feel free to put your questions in the chat throughout the presentations today, and we'll have some time at the end for that question and answer and discussion time. Next slide, please. Also, your feedback is really valuable to us. So we ask that all of you take a few moments after the presentations to participate in our feedback survey. It's going to pop up on your screen at the end of the training. We share the results with our evaluation partner at the New York Academy of Medicine. So we really appreciate your participation in the survey. Next slide, please. As most of you know, TIFA, Trust for America's Health, or TIFA as we're commonly known, is a public health policy, research, and advocacy organization dedicated to optimal health for every person and individual. TIFA produces several reports annually, including our Ready or Not report, which focuses on emergency preparedness, and our Pain in the Nation report. So our Ready or Not report this year will be coming out next month, so we're very excited to be on time with that. For our healthy aging work, we have produced several reports on topics like housing, rural healthy aging, and the one you see on the slide here on aligning our 60s framework with the 10 essential public health services. Next slide, please. This year, our training series is all about the age-friendly ecosystem and public health's role in helping to advance multi-sector engagement. As we get started with our first training on the ecosystem this year, I wanted to provide you with a working definition of the age-friendly ecosystem, which is a multi-sectoral network of practitioners, providers, and organizations that prioritize improved quality of life for older adults, their families, caregivers, and communities through collaborative impact or collective impact. Right now, the sectors that you see on the graphic include healthcare systems, public health departments, the aging services sector, academia, businesses, and states, communities, and counties where age-friendly practices are being implemented. So we hope that in your neck of the woods, the age-friendly ecosystem includes even more sectors. This is not all-inclusive. These are just the ones that we've engaged with so far, but we hope to learn more from you along our journey this year in exploring the ecosystem, and hope that you will learn from us as well. So as we have been engaged in this ecosystem work for a few years now, we've learned a few things. And one is that to advance any age-friendly public health system or age-friendly ecosystem efforts, you really need supportive leadership. So today you'll be hearing from some of our partners who have experience in advancing age-friendly ecosystems in their states and can attest to the value of leadership support. Next slide, please. So I am pleased to welcome Sally Pitt, our partner from the state of Tennessee. She is the director of the brand new Office of Healthy Aging at the Tennessee Department of Health. And then we'll hear from Kari Bruffett, who's the president and CEO, and Emma Uridge, an analyst, both with the Kansas Public Health Institute. So I'm really excited to share the platform with our partners today. And so I will turn it over to Sally. Sally, welcome.
Thank you, Megan. I really appreciate this opportunity. Thank you for again inviting the Tennessee Department of Health to today's discussion on the importance of building the leadership to advance age-friendly ecosystem efforts. We're certainly trying to do that in Tennessee. Also, I'm very pleased to be joined by Kara and Emma from the Kansas Public Health Institute on today's webinar. So today I'll discuss the Tennessee Department of Health's age-friendly initiatives to support older adults through public health actions and partnerships. I'd like to share our journey, our strategies, and our unique approaches to improving the health and well-being for older adults in our rural communities, including the importance of our age-friendly ecosystem partners. Next slide, please. So first, a little background on our state and our office. We have an amazing team within the Office of Healthy Aging. Many cannot join me today because they're out there already doing the yeoman's work on everything related to healthy aging. But the Office of Healthy Aging, as Megan mentioned earlier, rebranded at the end of last year and now operates under two primary focus areas: healthy aging across the life course, and of course our expansion into the dementia infrastructure. So taking a public health lens, we're looking at a very proactive and population-based approach to aging, ensuring that individuals of all ages have the resources and support needed to maintain health and well-being, while strengthening our dementia-related services and systems across the state. Of course, leadership is key. We have a new commissioner, Commissioner Alvarado, who we believe is leading our Tennessee age-friendly ecosystem journey. Next slide, please. A little bit about the Tennessee Department of Health. We deliver public health programs statewide through our central office and rural health departments, uniquely offering primary care at local health departments. We operate 57 primary care sites and serve 89 of Tennessee's 95 counties, partnering with 6 metro health departments as well. Next slide, please. So, not unique to Tennessee, our state's aging population is rapidly growing, with 1.2 million residents age 65 plus. About 40% live in the rural areas throughout our state, facing limited services, workforce shortages, and high costs. Social and economic factors contribute to obesity, substance misuse, isolation, and mental health issues. The map at the bottom left-hand screen highlights concentrations of residents 65 plus, mainly in our metro, but yet some in our rural areas. As everyone on this webinar is aware, there are tons of health disparities associated with the older adult population, including multiple chronic conditions, transportation issues, housing, financial strains, caregiver challenges, lack of in-home supports, just to name a few. Next slide, please. Even before department level recognition as an age-friendly public health system, the Office of Healthy Aging focused on building a Tennessee where everyone can age in the community of choice, healthy and with the needed supports. Through awareness, service expansion, workforce training, dementia-friendly communities, policy development and advancement, and data-driven approaches, we continue to try to strengthen our dementia and healthy aging efforts. With continued support from our senior leaders and collaboration with national, state, and local partners, we can and are striving to create an age-friendly state. This slide simply highlights some of our many current initiatives. Next slide, please. As noted in the previous slide, each implemented initiative was not achieved by our office alone, but I should emphasize and highlight the importance of collaborating with national partners to build a state that truly supports aging across the life course. We do deeply appreciate the support from Trust for America's Health, Megan Wolf and Dr. Karan Phillips. Their guidance has been instrumental in our pursuit of age-friendly public health system recognition, both at the state and local levels. As a result, we've identified some of these key components that we feel are essential for advancing our work. An advocate to promote the why, to advance age-friendly initiatives, senior leadership, that was so key in our particular situation, to support positive aging as a life course approach. Again, our Commissioner of Health, Dr. Ralph Alvarado, is really our greatest champion for our work and improving the health of older Tennesseans. We know that it's important to build and expand partnerships within divisions and with new collaborations across the ecosystem. Integrating older adults into policies, plans, and public health practices, utilizing data and resources to identify older adult health priorities, and then implementing a framework like Trust for America's Health to enhance public health programs for older adults. The framework, of course, that we're using is just that. Next slide, please. So building on the previous slide about state agency partnerships, when Commissioner Alvarado took office in January 2023, he hit the ground running. He prioritized public health's role in improving older adult health. He initiated an environmental scan of state and federal funding for older adults, revealing that in 2022, our state spent $3.5 billion across 26 agencies and approximately 81 programs. Recognizing the need for coordination, he then requested our office provide him with a strategic plan. We didn't have one, but that led to the creation of what you see on the screen, the Tennessee Healthy Aging Roadmap. Over the next two years, he used this roadmap to unify budget requests, launch public health initiatives, and align efforts across agencies and communities. The highlighted areas in red indicate public health initiatives that have been expanded or implemented without state budget dollars. For example, our state dementia director, our dementia navigator program, navigators embedded in our local health departments, and faith and religious community engagement. Again, our strong partnership with UT Chattanooga and their statewide and multi-state efforts. Because of his messaging and his leadership, we now have a few leads from other organizations exploring a memory care assessment network that's listed on our roadmap, and even considering funding additional county level dementia navigators. So more to come on that area. Fingers crossed, really. Next slide, please. A key strategy for us in improving health outcomes and expanding our age-friendly recognition program, which is the area I want to talk about next, was strengthening our stakeholder network, shifting efforts from the central office to local and regional levels. By identifying existing healthy aging initiatives, we leverage public health expertise to enhance our collaborations. For example, partnering with our regional and local health departments to engage their city and county officials in our age-friendly initiatives. Collaborating with other state agencies to address social determinants of health, particularly in rural areas. Again, our Commissioner of Health championed both age-friendly public health systems and Tennessee's broader age-friendly ecosystem. Next slide, please. So the focus began on older adults and supporting older adults, guided by our senior leaders and our commissioner. Our state health improvement plan and our 4-year strategic plan for the first time integrate the age-friendly public health systems framework and metrics around older adults. Efforts extend to the regional and local health departments, embedding older adult health in their community health improvement plans. So just again, 3 primary areas that we continue to utilize as we advance our age-friendly efforts across our state and integrate into the age-friendly ecosystem. Next slide, please. So the age-friendly public health system framework really provided a structured approach to strengthen our expertise within our office and across the organization. It's very adaptable, which allows us to meet the unique needs of each region, local health department, and their communities. The flexibility enabled us as a state agency and at the local health department level to embed healthy aging is really a core component of our work, prioritizing that work by supporting training initiatives focused on equity, social determinants of health, utilizing this framework. Next slide, please. So how did we get there? How are we able to move the needle into an age-friendly public health system? So new public health leadership and support embedded and enabled expansion of efforts for older Tennesseans. Strong leadership, again, from our senior leaders as well as our health commissioner drove engagement across agencies and communities. Advocacy from the Office of Healthy Aging and other divisions and offices and partners supported progress. And again, a clear framework aligned with priorities and backed by the Trust for America's Health guided implementation. Next slide, please. So this is the age-friendly public health system implementation process we utilized in our rural health departments. We reviewed and aligned analyzing data to identify the gaps and integrate the age-friendly public health system with state plans and existing community health improvement plans. Leadership buy-in, that was so important, with securing senior support to incorporate the age-friendly public health system into regional and local health department plans. education and collaboration, shared data and strategies to strengthen partnerships in the aging sector. And then implementation, developing action plans with set timelines to align with existing initiatives occurring at that county level. Next slide, please. So this is an example of how we told that story with data in West Tennessee. This is where we started our first age-friendly public health system work. Learning from each that we go to, each region is really different and unique. The framework was first implemented, as I mentioned, in our West Tennessee region. That's 19 counties, very rural area of our state, working closely with those 19 rural health county health department directors. We use data to tell the story of why the health and well-being of older adults should be a core function of our work. In this region, as you can see from this slide, 16% of the population is 65 and older, and 11 of the 19 counties rate in the state's top 15 of Alzheimer's disease prevalence. So using this data, the goal was to identify older adult health priorities, which would align with the community health assessments and community health improvement plans, as well as to support the state health improvement plan and our 4-year strategic plan. Next slide, please. So to gain support from the regional and local health departments, we prioritize making the process simple or an easy lift by encouraging them to integrate existing CHAWS and CHIPS and regional plans into their age-friendly public health system action plans. In most of the 19 counties, mental health emerged as a key focus areas in their CHAWS and their CHIPS. This newly developed Promoting Health Among Older Adults practice guide provided valuable data on older adult health, including mental health, along with a list of ongoing initiatives and age-friendly partners for them to consider as they develop their action plans. Next slide, please. Next, we engaged with West Tennessee leadership to present the framework and secure commitment. We organized 2 separate events, but this one on your page is our first event where we hosted a full-day meeting with health departments and our aging sector partners, including Trust for America's Health. Each local health department analyzed older adult data, evaluated programs, and identified gaps in their CHIPS and their CHAWS. Working with community partners to induce the 6 C's approach to guide their action plan development, focused on health promotion, emergency preparedness, and mental health. Next slide, please. So I really wanted to highlight how this process occurred. Now, this was not in West Tennessee. This is as we moved across our state into Northeast Tennessee, but I thought this was a great example to show. So it highlights the work of the Hawkins County Health Council and how they leveraged its community health assessment to identify older adult needs. They focused on transportation in their CHIP. So through the age-friendly public health process, they built on this work to develop their age-friendly public health system action plan, which is noted on the left of the screen. Collaborating, for example, with a local university and community partners, they're now pursuing Tennessee's AARP, Age-Friendly Cities and Communities membership. So I thought this was a great way to highlight the easy lift to incorporate current work into the action plan. Next slide, please. So the next steps after each local health department completes its age-friendly action plan and receives recognition, this is a time for us to celebrate their success. We host a half-day meeting with regional partners to enhance collaboration. This is where we really start to work more with our age-friendly ecosystem partners. So we strive to showcase how multiple sectors are collaborating to support older adult health and well-being through various age-friendly frameworks and strategies. We ask each of our age-friendly ecosystem partners that are presenting at this half-day celebration to really emphasize the benefits of a multi-sectorial approach and include a call to action, if you will, strategy to encourage attendees to reach out to learn more or to join their initiatives. Emphasis is really placed on the importance of cross-sector partnerships in advancing older adult health. The age-friendly partner our age-friendly ecosystem partners, as I mentioned, share their key initiatives and frameworks to show it's not just about public health, but it's about health systems, it's cities, it's communities, it's universities. The other neat part that we've been able to do is our Commissioner of Health and the Commissioner of the newly formed Agency on Disability and Aging present a unified vision for improving older adult health. Next slide, please. So what's next for Tennessee? Well, currently 50 counties, by March 7th, we're hoping 50 counties, local health departments, 4 regions will have received the age-friendly public health system recognition. We currently have 2 metro health departments, so we're getting there. We've got 4 more of those to reach out to. By August 2025, fingers crossed, a total of 89 counties, local health departments, all 7 regions will be recognized as age-friendly public health systems. So we're super excited about that work. Again, thankful for our commissioner's leadership. And again, the partnership with Trust for America's Health. Age-friendly ecosystem. So where are we at on that? Where are we moving to? Our commissioner remains a steadfast champion for expanding Tennessee's age-friendly ecosystem. Recently, we brought together 7 universities to discuss the Age-Friendly University Global Network. Recently, one of the participants, Middle Tennessee State University, became Tennessee's first age-friendly university. And I understand we have a couple of other additional universities that are finalizing their applications. We are also continuing to collaborate with the Tennessee Alzheimer's Association. That is the organization that is leading our age-friendly health systems work in Tennessee to support the expansion of age-friendly health systems. We've got a meeting coming up in the next couple of weeks with our Tennessee Hospital Association to be able to share that particular framework and encourage additional applications and memberships, as well as with the Tennessee AARP to expand the network of age-friendly cities and communities. And of course, continuing our partnership and collaboration as we continue to expand the work on the Tennessee's multi-sector plan on aging. And that is under the umbrella of our new state agency on aging and disability. So next slide, please. Sorry, I think I advanced quickly, and so we can go to the last slide at this point. So again, here's the contact numbers, emails. Please reach out to us with any questions after today's presentation. I'm sorry I can't continue. I've got another meeting that I'm heading to, but again, I really appreciate the opportunity, Megan. Thank you very much.
Thank you so much, Sally, for being here. Terrific work. We're so proud to be a partner of the Tennessee Department of Health and all this work, and we will see you soon. So thank you so much. And if anybody has questions for Sally, please go ahead and share them, and we'll share them with Sally and get answers back to you all through the registration emails that we have for you. So thank you, Sally. Appreciate it. So at this time, we are going to now turn to Kansas, and I'll invite Kari and Emma to come on and share a little bit about their journey and the importance of leadership in their work as well.
Thank you, Megan. So I'm Kari Bruffett. I'm the president and CEO of the Kansas Health Institute. We are based in Topeka, Kansas. We are right across the street from the state capitol. I'm actually working from home today, so I'm in a guest bedroom. But if I was in the office, I'd be right across the street from the Kansas state capitol, which gives us great advantages working with our partners in state government, both in the state legislature and state agencies. And as you'll hear, that's a really important part of our work and really engaging with the leadership, not only elected leadership and not only agency leadership, but also leadership of community organizations and really across sectors that are impacting health. And that's been a very important part of our work. We're at a different stage than Tennessee, so we're working on the age-friendly action plan. And I was so excited a couple years ago when I was at the NNPHI conference, and there was the breakfast breakout session at tables to learn about this thing called age-friendly public health systems. And I went to that table, ate a little breakfast, and got very excited. My background before I came to KHI, I worked in state government in Kansas, including at the Department for Aging and Disability Services, and before that, the Department of Health and Environment, the Medicaid agency particularly. So I heard this and I thought, gosh, and the more I learned about the 6 Cs and the Cs, and particularly the connecting and convening, I thought, what a huge opportunity for us to engage with partners in Kansas who really care about aging and age-friendly practices, but maybe have kind of worked within their own programs and agencies. And maybe what could KHI's role be in helping connect and convene those partners? So I'm very excited to talk about our process, and I'll hand it off to Emma in a few minutes to describe more of the details. But you can advance to the next slide. Just a real quick thing about KHI. We are a member of NMPHI. We're a nonprofit, nonpartisan educational organization. That's our building. We were pleased to also get that age-friendly designation, I think last August, I think that was, so that was exciting. We've been around since 1995, established by one of the hospital conversion foundations in Kansas, the Kansas Health Foundation. So KHI has been around a long time working on health policy, education research, and health services research. And had at the time of the NMPHI meeting, when we had the breakout session, had really started to think about how can we be more purposeful in thinking about our work and health policy work in supporting aging and issues around aging in Kansas. And part of our work is we're committed to meaningful conversations around sometimes the tough topics, sometimes exciting and engaging topics that are related to health. So for us, the National Network of Public Health Institutes, thank you, Megan, for acronym check there in the chat, really helped sort of like make that connection and thought, this is one of the ways we can help advance this work. We had in the previous years had been involved in facilitating task forces around. There was a task force in Kansas called the Senior Care Task Force that was legislatively convened. It had legislators and folks from the aging sector, particularly, that had been involved. And we know that Kansas was working on the Healthy Kansans 2030 plan, and when we looked in, state plan on aging or the public health plans, we saw not necessarily always the words, but the issues that are really related to aging across all those plans. But what hadn't happened, at least at that point, was sort of that really cross-sectoral planning together. So that was what was exciting for us. We leaned in on connecting and convening, but I would say we've also really some related Cs that aren't necessarily in the 6 Cs, like the collaboration, which is part of connecting and convening. We thought that's something we could help connect. And the cross-sector work, the multi-sector or cross-sector, to make it a C, was super important to us. If you go ahead and advance to the next slide. So once I came back from the conference where I learned about this upcoming opportunity to apply to be a partner through NMPHI with age-friendly public health systems, we engaged immediately with some of the executive leaders at our state agencies, particularly the Kansas Department of Health and Environment, which, in addition to being the Medicaid agency, is also the public health authority in Kansas, and with our Department for Aging and Disability Services and the Department for Children and Families. And we get sort of two for the price of one with those two agencies because we have a wonderful secretary who is dual secretary. She dual hats, two different cabinet agencies. And then also wonderful secretary of the Department of Health and Environment, who's very familiar with KHI's work, actually a former board chair for the Kansas Health Institute. So even before we applied, and for those of you who went through that process, if you're another public health institute and went through that process, we knew that part of the application was saying, hey, you're going to be able to create this age-friendly action plan, state action plan that involves the public health agency. So you really needed that buy-in. So we knew we needed it. We went to the first meeting where it was a meeting about a related topic, and I brought up, hey, here's this opportunity with the Department of Health and Environment. And immediately the secretary and a deputy secretary in the room was like, we were just talking about this, how important this is going to be to do this work as the public health agency working with other agencies to advance age-friendly systems in Kansas. And so we wrapped in as well with our the Older Americans Act agency, which is the Department for Aging and Disability Services, the Department for Children and Families, which among other things includes Adult Protective Services. And all the leadership was immediately engaged. That gave us a great advantage. And really a leg up to start the process once we got the news that we were awarded. Those secretaries also helped us identify, and some of the folks we knew already, but we also helped us identify key leaders in their agencies who could be part of our steering committee. And from that steering committee, we learned about a process that they'd used for some other similar work in early childhood, developing an early childhood plan, which was having a steering committee composed primarily of state agency partners sort of in their official capacities, but then supported by and engaged with an advisory committee that included many other folks, including from other state agencies, but also from local communities, from the sectors that were involved in that work. And so Emma will walk us through what that looks like. But one of the things I would say was a lesson for us is listen to those leaders and what has worked and what potentially could work maybe in another sector of work, and how could we use that same process that was successful to try to bring in, to learn from that process and bring in other voices. So that's been an important part of our process. Emma will kind of pick up and take us through where we are with our advisory committee and where we are now in our process of creating the action plan itself. I will say she's also, hopefully, if time allows, we'll be able to talk a little bit about how our work also intersects with other age-friendly work that we know that's going on, including some multi-sector work that our state agency is part of with a number of other, a learning collaborative with other states. We also have met and are planning collaboratively with a 4Ms group as well, that looking on age-friendly health systems. And we've heard from and have presentations as to our age-friendly advisory committee from the National Rural Health Association, talking about age-friendly rural communities. So we see those connections and see those as really valuable. But we say this when we talk about policymaking. We don't think of policymakers as only being those folks who are in elected office who get to vote on legislation, or who are in agencies who are implementing policy. It's also everybody who's impacted by and can affect the policymaking process. So I think the same way about leadership and engaging leadership in age-friendly efforts. It involves all those folks that are in policymaking and policy implementation positions, but it's also everybody who's involved and affected. So our advisory committee includes older adults and caregivers, as well as folks from different sectors who not just the aging services and not just public health, but transportation, and I've got some folks in yoga studios that are a part of the advisory committee as well. So excited to hand this off to Emma, but I'll go through the next couple slides because we talk about our leadership, connections with leadership. So I wanted to give them credit. Sometimes they join us on these calls. I didn't see the names today, but we have Dave, Derek, Shonda, and Chrissy, and these are from three different organizations: the Department of Aging and Disability Services, the Department of Health and Environment, sort of the public health portion, and then Shonda is with the Medicaid agency portion of the Department of Health and Environment, and Chrissy is with our Department for Children and Families. Next slide has some other folks also from the Department of Health and Environment, all from different divisions within the department. So both the public health and sort of healthcare, and our BRFSS folks as well, and Medicaid agency. So we thank all of them. They're key, and they're also helping. Some of them are helping facilitate some of the task groups that Emma will talk about in just a minute. So they're not just giving ideas; they're really engaged in the work and they're hands-on. My last slide is the next slide, and then I'll hand it off to Emma. So in the application process, we asked applicants for the advisory committee to give us their ideas about the vision for an age-friendly Kansas. So to give an example of how we envision the plan sort of working, we assembled all of the feedback into a draft vision. And this is more of a vision narrative, as Emma says, than just a vision statement, right? It's kind of a vision and mission together. And then the steering committee modified, revised, and ratified this as our vision. So we really are talking about transforming insights across the state into system level improvements that enhance the health and quality of life for all aging Kansans. So really taking that ecosystem approach that was very important to our group from the very beginning. And to achieve this, we need to bring together the stakeholders, resources, research, and expertise to create that statewide action plan. That's not just about awareness, but is really driving real change towards making Kansas a more age-friendly state. That was in our very first advisory committee and even the steering committee meetings before, the importance of this has to be actionable and we have to do the work is how we're going to measure the success of the plan. So we're excited to do that work, and I'll hand it off to Emma to tell you a little bit more about the nuts and bolts and how we get to where we are and where we think we'll get to that more age-friendly Kansas. Thank you.
Thank you, Kari. Hi, everybody. My name is Emma Uridge. I'm an analyst at KHI and have been with KHI now for 3 years and some change, and I'm the lead facilitator for Age Friendly Kansas. That QR code is just a link to some other publications and work I've done at KHI outside of aging, but definitely aging is my niche and my passion area in my work. So next slide, please. So Kari kind of introduced how we're kind of operationalizing leadership in this initiative. And so I think it's helpful to kind of look at the timeline of key events that helped us get to where we are today and to get the level of engagement we currently have. So we can kind of pick off where Kari left off. So we started meeting with our steering committee early in 2024 and just began discussing the vision for the initiative and to also get insights from our steering committee members about priorities within their respective agencies that we can elevate within this initiative. That was really helpful for us to narrow the focus, and also it allowed us to do some targeted outreach to specific folks we thought would be great for really digging into strategy development. So we kicked off our recruitment for this advisory committee that summer, and we began recruiting at any event that would have us. So we began reaching out to partners and colleagues on community-based organizations, but also at our state agencies who work within the community and across these different professional networks in public health and aging. And we just talked about the initiative. We talked about what we hope to accomplish and the role an advisory committee would play in that, and how we wanted to be multidisciplinary and multi-sector in our approach, because we have such a broad view of health and public health. We recognize social determinants in all these areas and sectors that impact the health of Kansans. And so it was really important to us that we began recruiting and being multi-sector in our recruitment efforts as well. So we can then go into now January for December, where we're at right now and what we're looking at for this year. So we met with our advisory committee last fall and really started talking about age friendly. We talked about different community organizations and community-led efforts, state efforts to be age friendly in different sectors like transportation, community development, and we had a state and national speaker. And that was really just building up the capacity of our advisory group to think in age-friendly ways and to become familiar with what this initiative hopes to accomplish. And now we have switched now to a split up advisory committee where we have 7 working groups, and each working group, and I'll talk more about how we divided them up later, we'll be meeting twice with our quarterly all-member meetings up until March. So next slide, please. So when we were recruiting for our advisory group, it was really important to us that we put a role in their corner that fit their needs and also helped us as well and helped guide our focus within this initiative. So the advisory group will be meeting to discuss and focus on the action plan, but really talk about strategies and age-friendly principles and how to operationalize those practices in ways that may not have been there before. We also really wanted our advisory group to help us with resource identification, serving as content experts within their respective fields, and then also pointing us in the direction of promising research and data to have an evidence-informed action plan and strategies. But then to also be, and that kind of relates back to building capacity in age-friendly programs and practices in the fall of 2024. But now going forward, they can have that language and shared knowledge base of what an age-friendly public health system, an ecosystem, age-friendly communities, and just tying all these different initiatives together that we heard about when we first started meeting. Next slide. So I think it can be a daunting task when you're thinking of multi-sector engagement and trying to form a multidisciplinary group. You really think about the branding, the language you use. So when we were chosen to support age-friendly public health systems, knowing we have this broad lens of health and we know all the different social determinants, transportation, employment, education, we thought that the age-friendly ecosystem framework would be an incredible framework to engage in other sectors that directly impact health, but may not consider themselves public health professionals. We wanted people to see themselves in the initiative and to recognize their impact and their organization's impact, their agency's impact on the health of Kansas overall. So we decided to form an application process. This was a way to kind of see who would be interested in the initiative, and also when we were giving our kind of roadshow to different groups early on before we started finalizing the advisory committee, it was just a way to get people involved and to see where they were coming from, what their priorities were within their organizations and what they wanted to see. And I'll kind of go into that application and what it looked like here in a bit. But we used a Qualtrics survey to do that. And so it really set clear expectations for participation. We really just wanted to know is like, hey, this is really low stakes. We just want you to show up to meetings and have a discussion. We just want to hear your insights, your expertise. Even if you aren't working necessarily in traditional public health or aging roles, if you're working in transportation, if you're working in financial planning, in law, we want to hear from you and what you're seeing in your work. And then it allowed for us to get a vision of what the initiative looked like. And we already had age-friendly ecosystem framework in our back pocket when we were planning, and we really were identifying with the framework alongside our steering committee. But we saw that we didn't even have to necessarily say age-friendly ecosystem, but our group, when they applied, really let us know that that was what they were already thinking about. So within that application, next slide, please. We asked folks, we said, we used the application as an educational opportunity to introduce age-friendly ecosystem and what that meant. So we asked our applicants, our potential advisory committee members, thinking of the current age-friendly ecosystem in Kansas, how can Kansas better support the health and wellness needs of its aging population? And what we found was a lot of the insights we received from over 50 applicants, I would say, looked at it all fell into different domains of the age-friendly ecosystem framework. We saw folks were thinking about public health and the health of Kansans being impacted by transportation, by built environment, by community development, education, workforce, all these different areas. And so it when I was thinking of traditional public health services and systems, it was very clear that this group was already thinking multi-sector in their approach. And so it was wonderful to kind of just go ahead and say, okay, yes, we can have this group of multidisciplinary people and we're all on the same page of what an age-friendly ecosystem is and what we're talking about. So next slide. So our advisory committee is made up of multiple disciplines, of course, in public health and aging, but we also have folks representing legal offices and practices across the state working to prevent elder abuse, neglect, exploitation, also financial planning and estate planning. We have folks in academia. We have local and state and county government officials and local health departments. We also have advocacy associations working in aging and healthcare. And then also, of course, our research arm, which is so important when we're thinking through evidence-based strategies to include in an action plan. Next slide, please. And so it was also really important for us and for the buy-in for an age-friendly Kansas. When we think about the branding, we're talking statewide reach. And so it was important that we had statewide representation included including rural, frontier, urban, and we're also very intentional that what works for urban doesn't always or seldom never works for rural and frontier areas of the state. And so we wanted to be intentional with in order to have statewide buy-in, leadership buy-in, it was important to us that we emphasize that the strategies that we're working on considers both of those angles and geographic reaches. Next slide. And so this kind of gives you, I've kind of briefly touched on a few of the domains, but this is how our work groups are divided up. So from the preliminary strategies that we identified through our application, we sorted them and themed them out into these domains. So we have our public health initiatives group, the folks working in transportation. We also look at healthcare access and services. And then we have this cross-cutting work group. And so this was really important for our state agency representatives that serve on our steering committee, is that we're fortunate to have this group that is state agency director level, division director level, and they're all talking and we're all collaborating and we're all becoming more aware of what is going on within each respective agency. And so it's important that strategies that are multi-sector have ways for collaboration that are actionable and able to be implemented. And then we also have these other cross-cutting principles. These are areas that we hope to address through strategy development. So we would hope that the strategies we work toward prevent social isolation, support aging in place, but then also looking at financial planning and well-being as a key indicator for success as folks age. Next slide, please. And so with our age-friendly ecosystem approach, we recognizing our broad view of health, we've been able to engage with non-traditional public health professionals and put the age-friendly Kansas lens into sectors that we really typically haven't engaged with before. And it's also a way to complement and raise awareness to other age-friendly work. So Kari mentioned earlier our collaboration with age-friendly healthcare systems, age-friendly health systems, 4Ms. There's also age-friendly workplaces. There's age-friendly communities, and we've been able to talk with the representatives of those communities, but also AARP, who administers that Livable Communities program as well. So we find the branding approach for age-friendly ecosystem to be really an engagement tool to think through and try to get other sectors to see themselves as age-friendly and think through practices and principles for those groups as well. Next slide. Oh yeah, I just want to elevate Kari in the comments. So intergenerational programs has been a priority for the Kansas Department for Health and Environment now for several years. There's some legislative activity going on to ease kind of the licensing requirements needed for that. And if you're not familiar, intergenerational care models, they're nursing facilities or childcare centers that are kind of integrated. So the childcare center benefits from the nursing facility and vice versa for the residents. And so that's kind of an area we're hoping to elevate through this initiative. And that's been really resonating with a lot of our advisory committee as well. And so I'll touch briefly on how we've kind of structured our working groups, because I think it's important to kind of clearly define what you intend to ask of folks when they come and meet. So we have, of course, KHI serving as facilitation, but then we also have our work group members who are all respective subject matter experts within their disciplines. And then we just ask that they come to meetings and they contribute their ideas and discussion and share any resources they might have found. But then it's up to KHI then to kind of wrap all that information together and to contribute it into the action plan. Next slide. And so when we use registration tools for our fall meetings, but then also for our working group meetings as well. So this is what our age-friendly Kansas applicants across all those disciplines I shared earlier really wanted to achieve from the group. And so keeping these in mind are really important for us to make sure that we're staying on target and we're also serving the needs of the people we're asking to contribute their time and expertise to. Of course, number one, it is identifying needs and funding opportunities and also increasing community awareness and building that strong network of different disciplines to be multi-sector in their approach. Next slide, please. And so now I'm going to briefly touch on our facilitation tools because I've heard from Megan and others when people are approaching action plan development and this work. I've also heard from several of our advisory committee members. It can be really daunting to enter a meeting and discuss system level changes in sectors that don't typically think of themselves as public health or aging. So these are some tools that we use in our facilitation efforts to help with that. I will just touch briefly on them. Next slide. So the first is Padlet. It's a great facilitation tool. You can just drop a link in your meeting chat and you can have folks contribute their ideas. So for the strategy, it's obviously not flushed out yet, but this tool helps with that. And it also just engages your group. And so for our first work group meeting, so all 7 work groups will be using Padlet. You can see the strategy high level kind of overview in the yellow and the top header, but then we're asking the who, what, where, and why. So this is kind of that first step of really fleshing out what these strategies could look like. Next slide. And then you might have to hit it one more time. Yes. So this slide is really thinking of implementation and impact. So this is a rubric we can use to think through the different implementation steps. And I think it might have lagged because I think it's supposed to go all the way to the top. But well, it's just having a day. It's stopped in the middle. No worries. But you can see here, it's just a kind of a checklist of things to think through when you're looking at strategies and engaging with folks. So you'll see here you have the rationale, that's misspelled, but we'll keep it moving. And then we have our 6 C's within the framework to consider. And then on the left, you can see that implementation. Oh, thank you, Katie. You can see the different implementation steps to consider for each strategy. So how is it going to happen? Is it a program change? Is it a new program? Is cost going to be a barrier? What mechanism is going to accomplish this? Will it require a legislative session or bill, appropriation? And if so, maybe we should consider having a collaborator for this strategy who is maybe a legislator. You need a legislative champion often, and especially when we're talking appropriation and different bills and such. So at the bottom of this rubric, you can see as well key performance indicators. Those are incredibly important when thinking through strategies because people want to know, how are we going to measure success? How are we going to determine that this is successful and actually doing what we're asking it to? So it's a great way to ensure accountability that what we're talking about and hoping to pass or work toward or implement in different programs is valuable and important. Next slide, please. And so looking ahead, I think just having an age-friendly initiative and taking this broad approach has really served us well in looking at leveraging and expanding the initiative and moving into different initiatives that the state is already doing. So Kari mentioned earlier, we are part of the Center for Healthcare Strategies, not KHI, but Kansas, the state, KDADS, is part of the Multi-Sector Learning Collaborative. This collaborative is receiving TA to eventually develop a multi-sector plan for aging. The Kansas plan hopes to be about 10 years in that plan. So we're assisting with that effort and hoping to contribute maybe some strategies that kind of lays the groundwork for what that multi-sector plan can look like. Next slide. And then sustainability is huge. Sustainability was thought of very early on. And so when I think of building an action plan, I think of building the ship in the water. I have to have the end goal and of what I want to accomplish and what the group wants to accomplish in mind when I think of strategies. So I've already touched on assisting in that 10-year multi-sector plan for aging that'll span multiple years in planning and development, but then also ensuring that this action plan, and I'm using the words of our advisory committee, not just another report that sits on a shelf, right? We want to have it operational. We want to educate and use that action plan as potential curriculum. So we're exploring an ECHO peer-to-peer education model. If you're not familiar with the ECHO program, it's a education hub and spoke model. So you have your hub team of experts. In this case, we would be experts on this age-friendly action plan, practices, principles, other initiatives, and we would build out this curriculum to disseminate the plan to stakeholders around these strategies and principles that promote age friendliness. And then we also just hope to put the action plan in front of policymakers and stakeholders and decision makers in all the ways that we can. I think that's something advantageous about KHI is when we have a working group, like for example, the Senior Care Task Force, we keep track of the recommendations. So we facilitated that effort, but we track the recommendations. We see where they progress. And so we plan to do the same with this plan. And next slide, that might be my last one. And I talk about branding, but I also talk about just having a place that folks can go to track progress and to just get the spiel. And I think this landing page on our KHI website was really important for us. So branding was a huge component of this. It creates kind of like a shared, just when people enter an age-friendly Kansas advisory committee meeting, you know where you're at. And the branding was really important and important for us from the jump to differentiate it from other age-friendly initiatives like forums and like age-friendly universities, for example. So this landing page can kind of give you a look back of how we structured our advisory committee meetings. Those were our capacity building meetings from August 2024 to December. And that December meeting was when we had the decision to break up into working groups. So you can see kind of the nitty gritty for how we made that decision as well. And it's linked there in case you want to visit. All right, next slide. So again, if you have any questions about Padlet or our structure, the application we use for our advisory committee, any process stuff with facilitation, or just how we're progressing as a whole, or want to share the progress of your respective age-friendly initiatives, I'd love to hear more. You can email me at euridge@khi.org or scan my QR code. That'll take you to my email. And it's been great, Megan. Thank you for inviting us. And I'm just really excited about this initiative and just all the different doors it's opened up for us within state agencies, but in community level led efforts. So it's just exciting, and I'm excited to see where it goes.
It is, oops. It is really exciting, and we're excited to be on this journey with you. What fantastic information! What a journey you all have been on. Really, really amazing, fantastic. Sorry that we don't have time for questions today, but if you all do have questions, please send them to us, the AFPHS team at afphs@tifa.org, and we'll submit them to our speakers so that you all can have the benefit of having that communication. Or Emma shared her email address, so you can communicate directly with her as well. So let's go to the next slide and we'll wrap up. I invite you to our next training, which will be the third Thursday of March at 3 p.m., March 20th. You can register for this training and any of the trainings under our events section of the AFPHS website. And we'll be talking next month about the age-friendly ecosystem, how important it is to build trust and how you do that. So we'll have a really dynamic speaker next month for you as well. Next slide, please. So if any of you are pursuing the AFPHS Champion designation, please take a moment to note that you attended the training today by scanning the QR code or typing the web address on the slide into your browser to complete the attendance survey. If you are viewing this training as a recording, just pause right now and complete the survey, noting that you have viewed the training. And we'll go to the last slide. And just thank you all so much for your kind attention today. Thank you so much, Kari and Emma, for the fantastic presentation, but especially for the work you're doing and how inspiring it is. And I think the importance of having the leadership within that advisory committee has been so crucial to your efforts. And I hope that everyone got that. I think that was very clear during your presentation today. So thank you all so much, and hopefully we will see you all next month. And we can stop the recording.